So kind of how it works here at London Road Dental is if you're interested in finding more about the dental appliance, usually we do a free consult for patients. There's no obligation that once you come in that we're going to push it on you to try and get an oral appliance. We want to make sure that it's the right fit for you. Like I said, we oftentimes will encourage you to have a sleep test if you haven't already had one. That just gives us a baseline. It lets us know, where you're at as far as your sleep goes. And the respirologist, like I said, would be the one to determine that, who reads the results of the test. Once we know from that consult, we explain it all to you and let you know, kind of how the appliance works, show you what it looks like, and also be able to let you know, the benefits of wearing one. Then we also try to work with you and find out, as far as your coverages go, if that can help you in getting an appliance as well. The big concern that we have is we want to make sure that your health is the number one concern. So whether or not our appliance is the best fit for you or a CPAP machine, we want to make sure that that's the most important thing. After we decide that we want to do the oral appliance, what happens is all we have to do is take impressions of your teeth. And then once we do that, we can send it off, and it takes about 3 to 4 weeks to make the appliance. And then once we have it made and insert it, and it usually fits quite well the first time, we usually don't have too much trouble in that regard. Then we kind of just want you to wear it for a couple weeks, make sure that it's not bothering you at all and that you can tolerate the appliance. And then 2 weeks later, we have you back for a follow-up. At that time, we kind of show you how the appliance adjusts. And it adjusts incrementally so that we can kind of find the right spot to move your jaw forward, to be able to make sure that it's not bothering you, and also that it's being efficacious, that you can get that oxygen that you need while you're sleeping. And then from there, on that same appointment, we actually show you how to make those adjustments so that you don't have to come back every time to make those adjustments. There's also a little diary. It's a pretty good little package that every time you adjust it, you can just write it down, and also you can explain how you feel as you make those adjustments, if you're having any soreness or if you're feeling any better and that sort of thing during the day. And we usually see you back at the 3-month mark, and just to follow up with you, see if we've got you to the right spot as far as, if we feel like it's being efficacious for you. And then again, we see you follow up again at the year mark. And anytime in that area, if we want to do a follow-up sleep test to make sure the appliance is working, then we schedule that as well. If you yourself think you might have a problem with snoring or obstructive sleep apnea, perhaps your spouse or anybody around you has maybe mentioned that they can hear you snoring, or they may have witnessed you stop breathing during the night, please don't hesitate to call us. We definitely could help you out and be able to investigate and figure out if either a CPAP machine or an oral appliance is the best therapy for you. We can be contacted through our website at londonroaddental.ca, or you can call us at 403-327-3434.